everyone. Thank you all for being here today. My name is Kamaria Long, and I am an organizer with Planned Parenthood South Atlantic. I want to start with the reason why we are here today. Our shared values that we are fighting for. Every person should be in control of their body, their life, and their future. Every person should be able to get affordable health care from a provider they trust without the government interfering. At Planned Parenthood South Atlantic, we are dedicated to providing high-quality, bias-free health care, defending the right to bodily autonomy, and supporting communities with compassion and respect. That's how we began to lower Black maternal mortality and advance health equity for all. But the people who hold political power in this country are moving us in the wrong direction. Across the country and here in the South, access to sexual and reproductive health care is increasingly under attack. Black communities continue to face disproportionate barriers to care, rising Black maternal mortality rates, and a growing hostile environment that threatens our bodily autonomy, safety, and futures. Healthcare is an essential service, but rather than work to increase access to affordable healthcare and invest in public health infrastructure, the leaders of our federal government and the North Carolina General Assembly continue to prioritize corporate interests and tax cuts for the wealthiest among us. Take, for example, the Medicaid program. Medicaid is meant to support new and expectant mothers, children, seniors, adults living with a disability, LGBTQ+ people, and families living with low incomes. 2 out of 3 recipients are women, most of whom are reproductive age. The program plays a critical role in reproductive health, covering 4 in 10 births in the U.S., and funding 75% of all publicly supported family planning services. Since taking office last year, the Trump administration has gutted the Medicaid program and cut people off from care. People with Medicaid coverage in North Carolina are now blocked from using their coverage at any Planned Parenthood South Atlantic Health Center. The federal government is keeping our patients with Medicare coverage from coming to us for their birth control, cancer screenings, and treatment for STIs. And politicians at the state level are doubling down on these harmful cuts, moving life-saving care further out of reach. Right now, leaders at our state legislature are refusing to pass a state budget, making North Carolina the only state in the country without one. They are refusing to fully fund Medicaid for North Carolinians, and if they don't close the funding gap, more than 3 million North Carolinians who depend on Medicaid are expected to lose their coverage. Our elected officials are making things harder for working families, for people struggling to get by, for everyday North Carolinians. We believe healthcare is essential. We believe people deserve control over their own bodies, and we believe lawmakers should be working to make life more affordable, not less. Thank you. Next, I will be introducing Maya Jackson, founder and executive director of MAME.
Hello, everyone. My name is Maya Jackson, and I'm the founder and director of MAME, Inc. We are a community-based regional maternal health agency in North Carolina. In celebration of Black History Month, it's a time to celebrate Black excellence and all of those that have come before us to set the root in this work. This is a time for us to confront the realities that still impact Black families, but many American families. And one of those issues is maternal health. Black women in this country are still about 3 to 4 times more likely to die from pregnancy-related causes. In North Carolina, although Black residents make up 22% of the population, Black women account for 40% of pregnancy-related deaths, and nearly 90% of those deaths are considered preventable. We also have to be honest about how difficult it is for many families in North Carolina to access care. In many regions, communities are experiencing what it feels like more like a desert, but also can be considered a maternity care apartheid. When we decide where and how care is able to be accessed by geography, income, and race, families travel long distances for prenatal visits. Appointments are often delayed. If there are other intersections such as language barriers, that can also set back time, and not to mention the lack of providers. Providers are so limited because of the restrictions that are coming down that we've seen many within our healthcare institutional partners that residents are declining to practice in North Carolina. Not only that, but transportation is another issue. So many families that we see in our rural areas are traveling almost 2 hours just to receive a basic prenatal appointment. And sometimes that prenatal appointment that takes them 2 hours to get here, which is typically around 30 to 45 minutes, can last for hours if they're waiting for their loved one to come back to town to pick them up to access that care. And time off also becomes another barrier. So when we think about the amount of income inequalities that our families are facing, it costs just to exist. It costs just to take care of yourself and your loved ones. And those barriers become more of an emotional toll and financial toll on our families, even before that baby is born. At the same time, increasing restrictions make it harder for providers to practice. When laws limit the scope of care physicians, and many choose not to stay, which further shrinks the provider workforce in these areas that are already lack access. That leaves families with fewer options, and sometimes we've seen families thus far not even wait to get care here in North Carolina. They are now crossing state lines. We also have to acknowledge history. The dismantling of the Black-ran midwives who once safely delivered babies in Southern communities removed trust. It removed culturally rooted care from our systems. We disrupted community-based birth support without replacing it with equitable access. The result has created a strain in inequitable systems and does not serve everyone equally. These women were a part of a community that not only served Black women, but all women. And so once again, putting restrictions on how providers can provide care and who can access care has literally participated in a lot of the gaps that we're seeing with poor health outcomes. We know discrimination inside healthcare settings is real. Distance to care matters. Policy decision matters. When care is delayed, restricted, or dismissed, outcomes worsen, and Black families feel that impact first. Abortion bans do not improve maternal health outcomes. In many cases, they make accessing prenatal care even more complicated and delayed for families, especially in communities already facing provider shortages and transportation barriers. They also undermine bodily autonomy, which is foundational to safe, respectful health care and true health equity. And while Black women are disproportionately impacted, these restrictions affect all women. When providers leave communities, when hospitals close maternity units, when care is delayed or politicized, every woman, regardless of race, faces reduced access and increased risks. We do not need more government restrictions on care. We need government to expand access to comprehensive, timely, and respectful health care for everyone. That's where MAME comes in. Regionally, we're building a community-based support system around families. We provide doula care, postpartum support, maternal mental health, and lactation support. These services are not available to all communities in North Carolina. This is why it's important to ensure that we are supporting policies that expand food access in these rural areas. We serve families across multiple counties in North Carolina, not because geography should determine whether a mother survives pregnancy, but is thriving through pregnancy. This work is about dignity, it's about advocacy, and it's about bodily autonomy. It's about making sure that mothers are heard, supported, and safely cared for, and that all families before, during, and after birth are cared. Black maternal health is not a statistic, it's a systems issue that we can fix and address. And we're regionally working towards being a part of the solution. Thank you. Woo.
All right, thank you, Free and Just and Women's Choice, and to all of our providers, advocates that are here with us today. I'm North Carolina State Senator Natalie Murdock. And this specific issue was a big part of why I even decided to run for office in 2019. Abortion bans fall hardest on Black women and Black families. These bans block access to timely, comprehensive, and inclusive medical care during pregnancy, childbirth, and postpartum care. These issues are intersectional. Black women's reproductive justice is intersectional. It impacts every aspect of our lives. That's why the reproductive justice lens was created by Black women. Black women since slavery have been fighting for freedom to control our own bodies. As victims of rape and sexual assault, to breastfeeding children they did not birth by force, to Henrietta Lacks, all of her bodily autonomy being lost and utilized for medical advancement, to Black women that were treated as lab rats, leading to advances in modern OBGYN care. Reproductive justice is, in fact, why we are here today and should be lifted up during Black History Month. Abortion is health care. But when Senate Bill 20 went into law, abortion opponents manipulated the complexities of medical and personal decisions about pregnancy loss to distract from the real goal, to punish women and doctors, and to completely ban abortion care in North Carolina and states throughout the South by making it out of reach. These bans deepen an already deadly maternal health crisis. Black women are more likely to live in states with abortion bans. We are at an independent clinic today, and cuts to Planned Parenthood and others make comprehensive health care harder to access. I was a proud Planned Parenthood patient, using their services even with insurance when I wasn't able to get a timely appointment with my OBGYN. The monster abortion ban resulted in giving people, forcing them to carry pregnancies that they did not want to move forward with, give birth against their will. It led to people being turned away when they really needed life-saving care, forcing people to travel long distances and even out of state for time-sensitive essential health care. What we all know is abortions will always occur. It's just a matter of if they will be accessible. Far too often, they are not accessible to people and women that look like me. Extreme anti-abortion politicians have created a monster by pushing new restrictions that aim to shut down abortion clinics, making it even harder for a person to get abortion even before 12 weeks, including medication abortion, and restructuring anti-abortion restrictions that we defeated time and time again long before I came to the General Assembly. What should we be doing in Raleigh that we're not doing? Fully funding Black maternal health support, because Black mothers and babies are dying each day. You heard some of those other groups that we could be funding. Fully funding paid family leave so that poor people do not lose out on their jobs simply because they are sick and don't have the leave they need to care for their families or to take care of themselves while they're still pregnant, and to provide access to contraceptives so that if people can have full control over if and when they want to have children. Now more than ever, we have to continue to ring the alarm. We're already seeing the effects. We have in fact had deaths here in this state as a result of Black women not being able to have access to care, Black women with education, Black women with health care, so let alone what's happening to Black women that do not have access to health care and do not have resources. So now more than ever, we have to continue to shed a light on these issues. We have to stick up for these women that don't have the opportunity to have a platform, that can't get the word out. We can't continue to ignore these issues simply because this law is passed. Now more than ever, we have to bear witness and tell these stories so that one day North Carolina will get it right. We will turn the page. We will return to being a state that provides women of all shapes, forms, and sizes, all birthing people, with the reproductive care that they deserve to have, because abortion is health care. Woo!
Thank you so much, Senator Murdock. It's such a privilege to have you here, and thank you so much to our wonderful hosts with the Woman's Choice here in Raleigh. You're an incredible resource to this community, and it's really, really important that you're here. So thank you on behalf of all of us for the services you provide. I know we have folks from the media here. If you have questions, we're happy to do those here or coordinate some pull-asides. But again, if anyone has any follow-ups or they need anything from Free and Just, you have my email, and I am happy to help. Thank you so much, everyone. I really appreciate it.
I do have a question for folks. I'm going to stand because
Yeah.
it feels rude to ask questions. For the folks at Planned Parenthood, could you talk a little bit more about the effects of the block of using Medicaid funds for all sorts of issues that Planned Parenthood offers, the effect of the day-to-day lives? And then related to that question, I'm sure we all saw the ProPublica article a little bit ago of the Black woman, a police officer, who was denied heart care because she was pregnant, and then died of a heart attack while waiting to get abortion care because of the backlog. So can you talk a little bit more about effects like that of how an abortion ban is dangerous for reasons that people may not realize, kind of tangential but definitely related to pregnancy?
Do we want to start with Planned Parenthood and then maybe Senator Murdock, you can weigh in?
You want me to take it or do you want to take it?
You can take it if you like.
You want to come up here?
Yes.
Okay. So we get the show
Okay.
for it. Thank you, Michael.
And let me know.
Pick
I know
on
that
everything.
was-
I know. On brand.
Do I want to take it now?
Listen.
Sure. So Jillian Riley, Director of
Public Affairs.
Director of Public Affairs, Planned Parenthood South Atlantic. So I'll first just say that the Big Beautiful Bill, HR 1, had a really direct impact on patients with Medicaid across North Carolina. The reality is, Medicaid insurance provided care for family planning services, STI testing, birth control, pap smears, breast health services, cancer screenings, Medicaid patients are no longer able to come to Planned Parenthood for those basic services. We know the reality is across North Carolina, we have a public health crisis in this state, specifically with maternal health and reproductive care, the holistic reproductive care, right? Taking away an access point for Medicaid patients of where they're able to go is detrimental, right? We already have incredibly long wait periods at our county health departments and with primary care providers. Don't even want to get into the hospital waits, right? To be able to access something as simple as an STI test, which is critical for a person's health. So that is right now we are under a ever intense federal dismantling of our public health system, and how that is playing out in North Carolina. I think we're still seeing the rippling effects of what that means, and we'll continue to see that over the next couple of years as the impacts of HR1 continue to unfold and people begin to lose Medicaid left and right for a variety of services.
Very fast follow-up on that. Are people still calling to try and make appointments that you are having to turn people away from?
Absolutely. People are having to pay attention to the federal, what's happening at the federal level around their public health insurance, right? Medicaid is a public health insurance program. We should not be having to debate in this country whether or not anyone deserves access to quality and affordable health care, but that's exactly the debate that we're having. And so when we look at our patients specifically that we're using Medicaid at our health insurances, that is folks with low incomes, right? That is people trying to access we have working families. We have a lot of women trying to access care, reproductive care at our clinics, right? Something as simple as an STI test, you don't necessarily know that you need it till you need it, right? So maybe they haven't used their Medicaid insurance until recently, right? And then all of a sudden they're accessing our clinic, and we're having to explain to them the realities of the federal impact, and absolutely helping them navigate where they can access care or how they can pay out of pocket for that services at Planned Parenthood health centers.
Thank you. And I would, if someone could talk, I would love to hear more about, because that answered the second part of my question a lot too, but just the ripple effects down the stream and the way people may not realize on the effect of the overall health. I mean, the heart thing, I would never have thought that someone may not be able to get the heart procedure they need.
Well,
How the abortion ban is not just affecting reproductive health in that moment, but all health, all doctors.
Yeah, I mean, I can just address that really quickly. I mean, what I have heard abortion providers say over and over again since the fall of Roe is that they are having to contact their legal counsel, whether that's at an individual clinic or at a hospital, in order to be able to provide abortion care, even in those emergency case scenarios, right? Because once again, like, the policies are now guiding medical care rather than the patient and the medical expert guiding the medical care. I think what we've seen happen, not just in North Carolina, but in other states where we have extreme abortion bans and restrictions on abortion care, is the rippling effect of how it impacts all forms of healthcare, right? I mean, it's detrimental, it's unconscionable, it's sick. The reality is we need to be expanding access to all forms of healthcare, especially reproductive care, not making more restrictions. And we know that there are going to be more people who are impacted by this ban who are trying to access basic health care like abortion care, and they have complex health needs. So many patients are like that, whether that's a heart problem or someone has been diagnosed with cancer or has a brain tumor and is also pregnant. Those people exist every single day, and their doctors are having to ask their attorneys whether or not they're able to provide cancer treatments before they can get an abortion, right? And if they need an abortion, can they even offer that in North Carolina, or do they have to travel out of state to access that care? Those are decisions people are making every single day.
yeah, and I'm happy to
Thanks, Senator Murdock.
Thank you, Doug. I think that's why we need her here. I think Jillian did a great job of teeing that up. And to first lead with how ridiculous it is. Like, if you were to look at another medical condition and it's an oncologist trying to treat a patient with cancer, You don't have the General Assembly coming in saying, hey, oncologist, even though your prognosis says you should do X, Y, and Z, we're going to create a new law to make it more difficult for you to do that. When it comes to controlling women's bodies, the North Carolina General Assembly, conservative majority, and other states, they are laser focused on controlling our bodies to the point that they're not thinking about the other medical conditions they have and how intersectional it is. And that's exactly why you have instances such as what happened with that phenomenal police officer that had that heart condition that you mentioned. And we warned them. Unfortunately, as we were debating this bill, we said, you are not physicians, right? Politicians make crappy physicians. You need to choose which one you want to do. And when you limit a medical care provider who is an expert in that space, and you go in and say 9 weeks, 10 weeks, 13, and you can't. You cannot have legislation that games out every single possible scenario. You need to leave it up to the physician. And they're so focused on abortion that they forget it is a medical procedure. So when you try to over legislate a medical procedure, it doesn't give those physicians the freedom to do what is best for that patient, which is why we need to leave it up to the experts. And definitely, as was mentioned, you in real time have attorneys huddling up with physicians in real time. Hey, I have this case, but because of liability, because of this ridiculous state law, we don't know what we can do. As a physician, they know what they should do, but they then have to huddle up with these attorneys because they're focused with liability, they're focused with being sued, they're focused with losing their license. It's already very expensive to practice as an OBGYN. So on top of all of that, they're fearful of breaking state law and potentially losing their license altogether. So we've lost focus of the patient and centering patient care. And that horrible example that we will be talking about a short session through some legislation is a perfect example of why we need to back off. We need to let physicians do their jobs, and we will have more deaths. Again, as we warn my colleagues, we knew it was only a matter of time. More deaths will continue to come when you over-regulate the jobs of these physicians because you are laser focused on controlling people's bodies, especially women.
Thank you.
All right. Anything else? All righty.